Good afternoon, everyone. I'm Dr. John Milne. I'm the Senior Vice President for Real Estate Strategy and Operations here at Providence, and really appreciate everybody taking time to join us here in our second panel. We're talking about strategic planning from a real estate perspective, and really excited to welcome back our team that really does a lot of the planning work for us here at Providence. And I have them introduce themselves momentarily. Just have a brief disclaimer that we're have to kind of read in all of this, given that we are a healthcare organization. So just as a reminder, this broadcast really is only for informational purposes only. If you have medical questions, please reach out to your primary care provider or other healthcare professionals. So with that in mind, we'll go ahead and jump into our conversation here. So Michelle, you want to start and introduce yourself and your role here at Providence?
Hi, yes, thanks, John. My name is Michelle Bernard. I'm based in Portland, Oregon, and I'm the Director of Institutional Planning for Real Estate Strategy and Operations.
Suzanne?
Hi, everyone. I'm Suzanne Schwab, Land Use and Planning Director based in Southern California.
Hillary?
Hi, Hillary Altman. I'm also a Director of Institutional Planning for our Real Estate Strategy and Operations Group, and I'm in Seattle, Washington.
Right. So really appreciate all three of you joining me again for this ongoing conversation. This is the second of these LinkedIn and podcasts that we've done here. And really our focus today is to drill down a little bit deeper into, kind of the direction that Providence is beginning to think as we think about healthcare in a much broader state. And we have what we refer to oftentimes as Health 1.0, which is a very hospital-centric point of view with regard to where healthcare was, and that really was the legacy of most healthcare institutions. It was really hospital-based in terms of the way we delivered care. And we're evolving into what we refer to internally as Health 2.0, which really is now not so much focused on the hospital, but really looking at broader communities that we serve and looking at how do we overall expand into different sectors, recognizing that housing and other elements within urban design all influence the overall health of communities. And as we think as an organization to really manage the overall health of our communities and look at that as a real estate division, our mantra is really about developing health in communities. And how do we actually look at the built environment and the infrastructure of a community, and how do we be able to influence that? How do we partner with cities, with developers, with other organizations that share our vision to be able to advance the overall health of the community? And so I wanted to highlight two projects that our team has worked on and still working on. These are active projects for us, and for one in particular is a multi-year project that we're still in the very earliest concept level stages at. So don't want anybody to be thinking that this is finished product. You're getting to see behind the curtain a little bit of the way our team is thinking and evolving, but really thinking about mixed use development as an ongoing process and a tool that it's not just about the healthcare delivery in terms of building a specific clinic or a building that's there, but really about the broader community that's there and the different touch points that exist in a community, from wellness to food to housing, and being able to, how do we lace all of those elements together in a way that really does drive health. So Michelle, I'd love for you to introduce us to Reed's Crossing as a project that you've worked on in the Portland area there, and kind of some of the elements that your team has been thinking about as they think about what that looks like.
Great, thanks, John. Yes, so Reed's Crossing is a 450-acre plus mixed-use development that is going on right now in Southwest Portland market. So if any of you are familiar with the Southwest Portland market, it is a growing and thriving community. It's actually in between, the development itself is in between two urban cities within the Portland area. On one end, you've got Beaverton, and the other end, you've got Hillsborough. Both of those cities are major employer markets. Some of you might know Nike and Intel and Tektronix. And so Reed's Crossing lies right in between those two, which is exciting because it's a thriving community, but also it's actually at the edge of the metro urban growth boundary within the Portland market. And so, not to steal any thunder from Suzanne's planning expertise and land use, but the urban growth boundary is actually a planning line that essentially controls expansion into protected forests and farms. And so the ability to continue to develop within the urban boundary is actually, it's a very valuable market to be in and an asset to grow in. And so for us, the Reeds Crossing development proposed two things for us. One, greater access into the Washington County market, which we already have a strong foothold in, but it just allowed us to be able to provide a greater level of access within that county. And then two, it allowed us to think beyond the medical uses within a planned community. And so we got really excited about a potential partnership with the developer to create a wellness center in the development community. And so we are going to be providing indoor and outdoor aquatics, childcare services. We're also expanding into fitness centers, not only with virtual classes now that we're in a COVID era, but also wellness and dietary and nutrition classes, and experts on site to even also do kind of our complementary medical services, such as our women's program, primary care. And so it's just a nice encapsulation of complementary medical and non-medical services together. So we're excited to be able to fulfill on our promise to be our partners, to be our community's partner to enhance health.
Thanks for that overview. And I guess one thing I just want to make very clear in this is we're not the master developer for this process. We have come in and partnered as the healthcare lead within this larger development complex. So there are the housing is being done by an outside developer, the retail is being done by an outside developer. But I think the thing that's really, for me, interesting in this is that partnership that comes in is we're able to bring our expertise to that discussion as a healthcare provider and being able to help think about the broader health of that community as that community gets laid out, and being able to be involved with it early on in that. Your team's been able to help influence some of the thinking from the developer's perspective, correct?
Yeah, absolutely. We were actually able to leverage some of their psychographic information that they provided around the consumer habits and the lifestyle choices that they were anticipating the residents of this area to be. So it was fascinating to align that with our mission and vision for how we would provide care to our own patient populations and see that overlay. So absolutely, it was a good marriage of consumer information and our medical information and visioning.
Yeah. So we'll come back to Reeds here more in a minute. But Suzanne, I want to turn to you for a moment. So one of the other projects that we've been looking at is Mount St. Vincent in West Seattle. So you want to tell us a little bit about the way the city is looking at West Seattle in general in terms of how they're looking at land use and overall zoning and planning of that area, and then how our property in that potential has a way to partner with the city in that way.
Sure. So this is kind of the other side that you were describing, John, where we are the landowner on this property. And Hillary, feel free to chime in too, since you're up there in Seattle. But West Seattle has just been a booming area. As the city did its comprehensive plan update years ago, they included some new designations, land use designations within it that would allow for more flexibility in various areas of the city, and a focus of that were employment centers. And so while for the most part, West Seattle is really a neighborhood and home to many people, and I should say the Mount, our property there, our facility there, is home to also many people. We're also considered an employment center because we're providing care to seniors and elderly there.
Can you want to describe what's existing on that property, just so that people are aware of what's at the Mount right now?
Exactly. Yes. So it's a really unique property. We have 2 buildings on the site. One that houses our sisters for Providence. So as our sisters retire, they have a lovely place to go. And then another is community for an assisted living and apartment living or skilled nursing, and then apartments for assisted living. And the property is about somewhere in between 8 or 9 acres, but we basically take up 1 full square block. And we're really integrated within the community because the building is very unique and also houses a child development center. And so we're able to provide multi-generational care on one site, which has been very unique, and it's been a part of the fabric of West Seattle for years. Unfortunately,
Yeah, so this is an interesting site in that. So the actual mount, the history of it, and I'm probably going to get some of this wrong, so please correct me if I miss on it. I believe is over 100 years old in terms of the bones of the original site. It was originally a nunnery, or where we had the sisters had schools, and many of the sisters and came went to school and got trained, and it kind of became and evolved into being used for more senior housing, evolving from that original purpose. So there's a gorgeous chapel on the site that is part of the original area that was there. And then, as you mentioned, this is the legacy home for the Sisters of Providence. This is where when the sisters retire, they come and retire onto this property. So it's a very special property for us as an institution within Providence, because this truly is the home for our legacy of the Sisters of Providence that's there. And so, as we were thinking about this property, we're looking at, given the bones of the property over 100 years old, and the last remodel, to my recollection, happened sometime in the 1960s. This is an aging infrastructure that we've got. It's something where we need to reinvest back in there to continue to provide services in this community, including a PACE clinic that's there, as well as, you mentioned, Child Development Center, and a variety of services that are really critical to our home and community care division are a part of that. But we're really trying to look at how can we do that more comprehensively. And so we had to look at the land use and the rezoning, and that's some of the work that you were working with the city as they were looking at their urban planning, correct?
Yeah, so the comprehensive plan that I was describing created these new hub urban village zones, or just an urban village zone. And so we had an opportunity to be included then within that zone, so that we could have some more flexibility in the standards for our development, and also the mix of uses as we start to plan for the next 100 years or so on the property.
So what kind of options does that give us, that change in the zoning to that area? How does that change the way we are able to think about what we could do on that piece of property as we're still in the planning stages for it?
So it really incorporates everything from uses, as I was describing, because we would have the opportunity to potentially add just residential uses that don't have any employment associated with them, as well as flexibility in the standards themselves. So the ratio for parking, as well as the height of the building. Right now we're about 5 stories. We have a little bit more flexibility there. For those of you that know West Seattle, there are some pretty amazing views from that part of the world.
Yeah, so I think the really interesting thing about both of these projects that we're talking about here is the way we're able to partner with cities and outside agencies around that in West Seattle in particular, to kind of rethink the overall land use that's there, and can we by incorporating into those types of changes that the city is already contemplating about how they're going to be able to do that, but by partnering with them and pulling us into that will give us some additional flexibility to really think about what is the future of healthcare delivery, and the partnership at Reed's Crossing with the developer that's there. And so I guess, as Hillary, turning to you for a moment, as we think about both of those projects, I know you spend a lot of your time thinking about overall, ambulatory care, and how are we delivering care in that Health 2.0 type of a mindset. How do those two projects, give us opportunities to really advance what is the future of healthcare look like, and the development in that kind of non-hospital centric world?
Yeah, I think both of these are examples that are pretty radical shift from our historical way of thinking, which is we have a site of care, and people should come to us. and we centralize all of our resources, and it's a brick and mortar location where people come to us. And I think we've realized that shift towards really distributing our care, and with COVID especially, we've really been flipping that program to say we really want to come and be embedded in the community in a very different way. And so while all of our historical strategic facility planning is really about building the campus and expanding the campus, this is almost the opposite.
Yeah, I think that's really important. And I think, thinking about, health and health delivery for us is more than just simple delivery of a particular surgical procedure or an infusion of medication or, convalescence in a hospital bed. It really is about, food. It's about exercise. It's about wellness. It's about a variety of different things that integrates into, housing being a critical component for us as we think about what is the hospital of the future, that a larger percentage of care delivery is going to be happening outside of the four walls of the hospital, and really moving into, it already is moving into ambulatory type facilities such as surgical centers and more clinic-based things. But our vision for healthcare going forward really is focused on a large portion of housing as health, and being able to deliver hospital at home type services in that process. And so I guess, Michelle, as we kind of pivot back to Reed's in that context, as we think about mixed use development, what are the things that you're seeing at Reed's and the discussions that your team has had at Reed's that really are about layering in, and things that, advice you'd give to developers who are wanting to partner with a health system and say, hey, I'm really interested in the health of a community and building a wellness or healthy focused community. What are the elements that a developer should be thinking about based on that should be incorporated into those types of planning exercises?
Yeah, absolutely. I mean, I think people more than ever want convenience. And so the distance from where they're living or where they're working, and the ability to get to a wellness hub, I think, is probably the most critical. And I think, too, what makes Reed's a little bit more unique, and it's really leveraging the just natural beauty of Oregon and the Southwest area with the forests. And they just are creating a lot of different environments by which you can be outside. I know that's kind of challenging during our rainy season, but people are out in the rain. People are definitely out in the sun. And so how do we as a healthcare provider enable people to be outside and cultivate a healthy lifestyle? And so having a developer create those walkable, exploratory areas where they can be on a trail really close to their house, and then your healthcare provider can work with you on healthy habit explorations. I think that to us is really about a holistic way of being, beyond just coming in and getting treated, but really being a provider to understand how to create healthy lifestyle habits, and just enjoying your neighborhood.
Got it. So, Suzanne, one of the things that you've been involved with, actually all of us have been involved with, is looking at how we change the way we use data, and looking at overall, our planning efforts as we think about it in a much more comprehensive way, the community. You want to talk a little bit about how you and your team are thinking about data, and how do we leverage that into the type of planning tools that we implement as a health system that might be complementary to non-healthcare developers or cities as they're thinking about how health intersects with overall community development?
Yeah, of course. So as Michelle even mentioned, for Reed's Crossing, there's a multitude of market factors that we want to be looking at, but really what we're working on internally right now is a geospatial platform to help us do that, so that we can see, on a map, if we're looking at the satellite or an aerial image of something, the properties itself, and then layer in and be able to, whether it's through a heat map or some data points, see where, whatever the layer is, if it's something to do with population or age, and how we can be doing that in a geographic way. And it helps us with everything from site selection to bolstering that market data and relationship with the developer, again, back to Reed's Crossing, helps us in our conversations with the city. Most cities are using similar platforms, but maybe not integrating as much data. And then, obviously on top of that, we can also put in our providers and our other facilities and proximity to those things, transit, walkability, things that Michelle was also talking about, that we consider to be making a complete community. We're able to look at all of those different points. And then the last thing I'd like to add that they wouldn't come in to play with those factors is also just listening to the community. And so for specific example of Mount St. Vincent, we haven't gotten there yet because we're so early in the process. But really talking to the neighborhood and the people we'll be serving is also an extremely important data set.
And so, Hillary, as you've been doing planning for many years here now with Providence, how does this change? I mean, what's been the pivot as you're looking at how the team is thinking about these types of things? I mean, as you bring in these new tools and philosophically some of the pivots. I mean, what are you seeing as the evolution of this over the course of the years that you've been working on this?
Yeah, I mean, I think your point about data is spot on. I mean, we before we would have some, rogue plans about ideas and opportunistic, just kind of all over the place. And I think now that we have data systems, we can really inform our, decisions with insights around population and demographics and use rates, and really see where communities are underserved or overserved, and where the competitors and partners are, and really look at those patterns of where care is provided in a very different way. And so that allows us to speak with our, physician partners and our communities to say, we've really got a foundation of data now that we understand what's happening. And I think that's, fundamentally going to change in 5 and 10 years, our ability to, as Suzanne points out, to map those trends and to really try to forecast into the future in a different way, and not just, eyeball it and that's probably right.
Yeah, I think that the unique thing that the data that we have access to, because as the proprietary aspects of it, obviously we're using de-identified data from our patient populations and whatnot. So we're not, we're very cognizant of HIPAA compliance when we're thinking about data. And this is, we hear stories sometimes about companies going in, tapping into healthcare data and being questioned about how those are getting used. We are very clear and tight on what the boundaries are with this. But as a healthcare system, using our own internal data, what the types of insights that and bringing a clinical eye to it as a health system, what we're able to do in comparison to other planning entities, potentially is to be able to look at this from that clinical lens and saying we're seeing areas of a community and specific neighborhoods that may have higher incidences of diabetes or hypertension or heart disease or other types of processes, and then looking at root cause analysis to be able to understand the broader social demographic instances and the social influences that may be driving some of those disease entities. For example, do people not have access to sustainable food sources? They're having to buy high fructose corn syrup, laced products as opposed to fresh fruits and vegetables. And, this is, looking at what those types of patterns as we think about it from a population health perspective. And so then starting to layer on population health and integrate that with urban planning and urban development becomes a really exciting, for me, opportunity to transform the fundamental fabric of our communities. And I think that's for me, the cutting edge. And I think for us as an organization, we're excited to be able to continue to replicate development processes like we've seen at Reed's and the things we're planning at Mount St. Vincent. And we've got other projects across the system in Texas and other markets where we're continuing to look at broader opportunities to be able to think about in a much broader scale. How do we actually truly drive health in the community by the way we're able to lay out the overall infrastructure of that community? So other advice you'd give to cities or developers who are, thinking about these kinds of things, other than to pick up the phone and give you a call and happy to provide the armchair consult there to our civic partners in all of this. But other advice you'd be giving to if somebody out there is an architect or a city planner or something like that you'd be giving them as if they're wanting to be thinking about the intersection of health and the built environment.
Yeah, I mean, I think to just ask people or to let people know that Providence is beyond just a medical vision for our communities, and that we do have expertise and a passion for complementary services beyond just the diagnostic and treatment facets of our business. I mean, we excel at that, of course, but I think we do have a passion for health that is beyond that. And so I think having thoughtful conversations about what that means and how we can enable that in our communities is really what we're really wanting to get as a longer term vision for development.
Great. Any other thoughts? We're coming out to the end of our half hour. It's flown by quickly here. So Suzanne, Hillary, any final closing comments as we wrap up? All right. So I guess don't want to. Dead air is not always a good thing. So I probably might jump there. I know neither of you are shy about sharing your thoughts, but I guess so. I just really want to just close this with to echo Michelle's comments there. I think for us, the future of healthcare and the future of care delivery is not in the hospital, and the hospital is always going to be an important part of any of the communities. And certainly, as a hospital operator, we are always going to be operating hospitals and seeking to provide the highest quality and value for care. But as we look at the future, the vision really for us as a health system is as a community partner. How do we actually embed ourselves in a much deeper way than we already are in the communities that we serve? How do we redesign the services that are in those communities to be able to continue to elevate the overall health of the community? And then ultimately for us as a real estate team, look at the strategic partnerships, whether it be with developers, whether it be with cities, whether it be with other healthcare delivery or other nonprofit partners, to be able to accelerate the overall mission of our organization with like-minded organizations in ways that really truly have the ability to transform communities. And we believe that the built environment really is that platform and that catalyst to be able to drive health across a broader community. So thanks to all of you who are out there watching and our conversation here today. And thanks, Michelle, Suzanne, Hillary, for joining me in this process today, this conversation today. This is really obviously a passion, I think, for all of us to think about how do we do this. And this is ultimately why we're at Providence. And I'm really excited that Providence has the leadership vision to be able to think more broadly about transforming communities in this way. So with that, I'll kind of share, our kind of closing comments with this, and, encourage anyone who is interested in learning more about Providence or any of our programs or initiatives or ways to be able to be more engaged with Providence, to reach out to any one of us directly through the real estate strategy or operations division within Providence, or come to our website to be able to learn about our programs and more about our medical care and the services that we deliver in the community at providence.org. Also, make sure to follow us on social media at Providence Health Systems on LinkedIn, and then also Facebook and Instagram, and Providence at Twitter. So we're on all the channels. We look forward to see you there. So again, thanks to all of you for engaging in this conversation, and have a good afternoon. Take care.